Did you know that colon cancer is the second leading cause of cancer deaths in the world? That's right, every year nearly 900,000 lives are lost to this disease. Despite its prevalence, colon cancer often doesn't get the attention it deserves. Today we're uncovering the shocking truths about colon cancer that no one tells you. Colon cancer, also known as colorectal cancer, develops in the colon or rectum. It's crucial to discuss this topic openly because early detection can significantly improve survival rates. However, many people are unaware of the risks, symptoms, and importance of screening. One common misconception is that colon cancer only affects older adults. While it's true that the risk increases with age, recent studies have shown a worrying rise in cases among younger adults. This misconception can lead to delayed diagnosis and treatment, making the disease more deadly. Additionally, many people believe that if they don't have a family history of colon cancer, they aren't at risk. The truth is, lifestyle factors such as diet, physical inactivity, smoking, and heavy alcohol consumption can significantly increase your risk. Another area where awareness is lacking is in the symptoms of colon cancer. The signs can be subtle and often mistaken for less serious conditions. Symptoms like changes in bowel habits, blood in the stool, unexplained weight loss, and persistent abdominal pain should never be ignored. Unfortunately, many people delay seeing a doctor because they don't realize these could be signs of something serious. Understanding these facts is essential for prevention and early detection. By breaking the silence and spreading awareness, we can help save lives. Stay tuned as we dive deeper into what you need to know about colon cancer. Number 1. Prevalence and misconceptions of colon cancer. Colon cancer ranks as the third most common cancer worldwide. Yet it is surrounded by numerous misconceptions that hinder effective prevention and early detection. Each year, it claims nearly 900,000 lives, making it a critical area of public health concern. One of the most significant misconceptions is that colon cancer is primarily a disease of the elderly. While it's true that risk increases with age, recent data reveals a troubling rise in incidence among individuals under 50. This trend underscores the importance of awareness and screening for younger adults, who may not consider themselves at risk and therefore delay seeking medical advice until symptoms become severe. Another common myth is that colon cancer affects men predominantly. In reality, the disease impacts both genders almost equally. Public perception needs to shift to include women in the conversation about risk and prevention, ensuring that all individuals are equally informed and vigilant. Furthermore, many people mistakenly believe that without a family history of colon cancer, their risk is minimal. However, lifestyle factors such as a diet high in processed meats and low in fiber, physical inactivity, obesity, smoking, and excessive alcohol use also play significant roles in increasing risk. It's crucial to communicate that while genetics are influential, individual choices have a profound impact on colon cancer risk. Addressing these misconceptions is vital for empowering people to take proactive steps toward colon cancer prevention, such as participating in regular screenings and adopting healthier lifestyles, which can dramatically reduce their risk and improve early detection rates. Number 2. Symptoms and early detection of colon cancer. Colon cancer is the third most common cancer worldwide, but it often goes undetected in its early stages due to subtle symptoms that are easy to overlook. Early symptoms include changes in bowel habits, such as constipation or diarrhea that persists for more than a few days, and blood in the stool, which might appear as bright red blood or a darker tar-like substance. Persistent abdominal discomfort, including pain, gas, bloating, or cramps, can also indicate colon cancer as the tumor affects bowel function and digestion. Another significant warning sign is unexplained weight loss, which may occur if the body is unable to properly absorb nutrients due to the tumor's presence. Additionally, fatigue and weakness may manifest from anemia caused by a bleeding tumor. Early detection is key to effectively treating colon cancer, and there are several methods available for screening. A colonoscopy is the most comprehensive tool, allowing for direct observation of the entire colon and the opportunity to remove polyps during the procedure. The fecal immunochemical test, FIT, is a non-invasive option that detects hidden blood in the stool. Flexible sigmoidoscopy examines only the lower part of the colon, while CT colonography uses advanced imaging technology to inspect the colon for polyps and cancers without sedation. Due to an increase in cases among younger adults, it is now recommended that individuals at average risk start regular screening at age 45. Those with higher risk factors, such as a family history or genetic predisposition, may need to begin screening earlier and more frequently. Engaging in regular screening and being vigilant about changes in your health can lead to early detection, significantly improving treatment outcomes and increasing survival rates. Number 3. Risk factors beyond age. While age is a significant risk factor for colon cancer, with most cases occurring in individuals over 50, there are several other factors that can increase one's risk irrespective of age. These include lifestyle choices, genetic predispositions, and environmental influences, all contributing to the overall risk profile. Diet plays a crucial role in colon cancer risk. Diets high in red and processed meats have been linked to an increased risk, while high-fiber diets, rich in fruits, vegetables, and whole grains can help to decrease the risk. This is due to the carcinogens formed during the digestion of red meat and the protective effect of fiber in the digestive system. Physical inactivity is another notable risk factor. Regular physical activity not only helps in maintaining a healthy weight, but also reduces the risk of developing colon cancer. Exercise helps to speed up digestion, which reduces the time that the colon is exposed to any harmful substances in stool that might trigger cancer. Obesity, particularly when fat is concentrated around the abdomen, is associated with an increased risk of colon cancer. Fat tissue produces hormones and other signals that can promote cancer growth. Smoking cigarettes and excessive alcohol consumption are well-established risk factors for many types of cancer, including colon cancer. Both habits can lead to the formation of carcinogens in the colon. Genetics also play a role. Individuals with a family history of colon cancer or inherited conditions like Lynch syndrome or familial adenomatous polyposis have a higher risk. These genetic factors can significantly influence the development of the disease, emphasizing the importance of genetic screening for those with a family history. Environmental factors such as exposure to certain chemicals or radiation can also contribute to the risk of developing colon cancer, though these are less common influences compared to lifestyle and genetic factors. Understanding these risk factors can help individuals take proactive measures to reduce their risk through lifestyle changes, regular screening, and in some cases, genetic counseling. This is particularly important for those with a higher inherent risk due to family history or underlying genetic conditions. Number 4, the importance of screening. Screening for colon cancer plays a pivotal role in reducing mortality by detecting the disease at an early, more treatable stage. This is particularly crucial because colon cancer often begins as non-symptomatic and can develop into a serious condition by the time symptoms appear. Regular screening is recommended as the most effective way to catch colon cancer early, when it is most manageable and treatment is likely to be successful. The most recognized method of screening is the colonoscopy. This procedure allows for a direct visual examination of the entire colon and rectum. During a colonoscopy, doctors can not only detect cancerous and precancerous growths, but also remove them on the spot, significantly reducing the chance of cancer developing or spreading. For those at average risk, it's recommended to start colonoscopy screenings at age 45 and continue every 10 years. But those with higher risk factors might need to start earlier and screen more frequently. Other screening options include the fecal immunochemical test, FIT, which tests for hidden blood in the stool, and the flexible sigmoidoscopy, which examines the lower part of the colon. These tests are generally less invasive than a colonoscopy and are performed more frequently. CT colonography, another less invasive option, uses CT scans to visually inspect the colon for polyps and cancers. Understanding and participating in regular screening is vital, especially since early detection can dramatically increase survival rates. For those with a family history of colon cancer or other risk factors, starting screening at a younger age and undergoing screenings more frequently can be life-saving. Engaging with healthcare providers to determine a personal screening schedule based on individual risk factors is a crucial step everyone should take. Number 5, treatment advances. Advances in the treatment of colon cancer have significantly enhanced patient outcomes, transforming a once daunting diagnosis into a more manageable condition. Key developments span across surgical methods, targeted therapies, immunotherapy, and chemotherapy, each contributing to more personalized and effective treatment plans. Minimally invasive surgical techniques such as laparoscopic and robotic-assisted surgeries are now the norm in treating colon cancer. These methods allow surgeons to remove tumors with precision, causing less damage to surrounding tissues, resulting in fewer complications and quicker recovery times. This not only improves the quality of life post-surgery, but also enhances the overall prognosis for patients. The rise of targeted therapies marks a significant shift towards personalized medicine in oncology. These treatments specifically target abnormal proteins or genes in cancer cells that contribute to tumor growth. For instance, drugs like cetuximab and panitumumab target the EGFR protein, effectively slowing down or stopping cancer proliferation in patients whose tumors express these specific markers. Immunotherapy has been a groundbreaking advancement, particularly for patients with genetic markers such as high microsatellite instability, MSIH, or mismatch repair deficiency, DMMR. These therapies boost the immune system's ability to recognize and destroy cancer cells, leading to some remarkable responses in patients who were previously considered difficult to treat. Furthermore, chemotherapy continues to evolve with the development of newer drugs and novel combinations that aim to increase efficacy and reduce side effects. This traditional form of cancer treatment is being refined to tailor specific regimens based on the genetic makeup of the tumor, optimizing patient outcomes. These treatment innovations are continuously evolving, driven by ongoing research and clinical trials. They provide hope and substantially improve survival rates for those diagnosed with colon cancer, highlighting the importance of continuous advancements in medical science and treatment methodologies. Number 6, lifestyle changes for prevention. Preventing colon cancer effectively involves incorporating several key lifestyle changes that collectively reduce risk factors associated with the disease. Adopting a diet rich in fruits, vegetables, and whole grains is essential, as these foods are loaded with fiber, vitamins, and antioxidants which protect against cancer. It is also beneficial to limit intake of red and processed meats, which have been linked to an increased risk of colon cancer. Opting for plant-based foods and lean proteins like fish or poultry can significantly alter your risk profile. Engaging in regular physical activity is crucial. It not only helps maintain a healthy weight, but also improves digestion and reduces inflammation, all key components in reducing the risk of colon cancer. Health guidelines suggest aiming for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity each week. Maintaining a healthy weight is also vital, as obesity, particularly excess abdominal fat, increases inflammation and hormonal imbalances that can promote cancer growth. Additionally, avoiding tobacco and limiting alcohol consumption are important, as both smoking and excessive alcohol use are significant risk factors for various cancers, including colon cancer. Staying hydrated supports digestive health, which is critical for preventing colon cancer. Water aids in keeping the digestive system clean and efficient, assisting fiber in its role to enhance bowel movements. Though not a lifestyle change per se, regular colon cancer screenings are indispensable in early detection of the disease, which can drastically improve treatment outcomes. By combining these lifestyle adjustments with regular medical checkups, individuals can significantly lower their risk of developing colon cancer and lead a healthier overall life. These changes require commitment and consistency, but offer substantial benefits for long-term health and cancer prevention. Colon cancer is a serious and potentially deadly disease, but with the right knowledge and proactive measures, it can be prevented and effectively treated. We've uncovered some shocking truths today, from the widespread prevalence and common misconceptions to the critical importance of early detection and the latest treatment advances. Remember, regular screenings can catch colon cancer early when it's most treatable. Pay attention to your body and don't ignore symptoms like changes in bowel habits, blood in the stool, unexplained weight loss, and persistent abdominal pain. Lifestyle changes such as eating a healthy diet, staying physically active, maintaining a healthy weight, avoiding smoking, and limiting alcohol consumption can also significantly reduce your risk. By understanding and addressing these risk factors, you can take control of your health and reduce your risk of colon cancer. Share this video with your loved ones and help spread the word about the importance of awareness and early detection. Thank you for watching. Together, we can make a difference. Don't forget to subscribe to our channel for more health insights and tips. Stay informed, stay healthy, and take care.